In this video, I'm going to answer the questions: what is cervical radiculopathy? What is nerve compression, aka a pinched nerve in the neck? And how does this cause neck pain? How does it cause numbness and tingling in the arms, hands, and fingers? If you have a pinched nerve in the neck causing arm pain or numbness and tingling in the arms, fingers, this will be a very important video for you. Not only am I going to answer these questions so you can have a better understanding of cervical radiculopathy, but I will also share with you one of the best ways to treat cervical radiculopathy without surgery or drugs for permanent relief that your medical doctor won't tell you. Be sure to watch the entire video so you don't miss that part, because it can be the very reason why your neck pain, arm pain, and nerve compression becomes chronic. Stay tuned to this video for my next Recovery Spotlight segment, where I'm going to talk about how Nicole has made a complete recovery of her numb finger and neck pain with this non-surgical approach. Plus, as a bonus in this video, I'm going to give you a key cervical radiculopathy exercise that you can do at home to begin to provide the relief you need. Hi, I'm Dr. Joshua Gelber. I'm a chiropractor in the Annex area of Toronto, Ontario, Canada. We focus on helping people overcome headaches, dizziness, vertigo, neck, shoulder, and back issues through specific chiropractic spinal correction techniques. But before I dive in, smash that subscribe button if you want to enjoy a more comfortable and active life with better posture, increased mobility, and free of chronic pain. Cervical radiculopathy is nerve pain that travels or shoots into the arm, typically presenting as numbness or tingling in the arm, hand, and fingers. But did you know that the source or the origin of this pain is not in your arms? The source is in your neck. That's why it's called cervical radiculopathy, for the cervical spine. But before we get into the nitty-gritty, let's start with the basics, okay? Here's our spine. It's the central pillar of our body. These yellow nerve roots that you see branch out further, as the image shows, are spinal and peripheral nerves connecting our brain to the rest of our body, including our arms. Now, cervical radiculopathy, simply put, occurs when these nerves in our neck get choked or irritated, causing pain, tingling, and weakness anywhere from the shoulders down the arms into the wrist and the fingers. But what's the main culprit behind this? Untreated traumas. Now, possibly it's an accumulation of small but repetitive micro-traumas. Think about all the small bumps, falls, scrapes, and bruises kids encounter over a decade or more. You know, most parents have faith that their child's durable, and it's true, but only to an extent. Or the macro traumas that aren't appropriately or thoroughly treated, like sporting injuries, car accidents, the small but impactful falls down, a few or more stairs, non-sporting concussions that can have an even more direct impact on the neck. Additionally, poor posture over time, as we see here, adds a similar stress and strain on the spine and ultimately the nervous system. Now, time will allow these misalignments to worsen, leading to decreased mobility, and even what we call loss of imbibition, where the discs in our spine lose their ability to exchange nutrients with the vertebra above and below, essentially, drying out like a sponge in the sun. All of these stressors in the cervical spine can initiate a cascade of degenerative changes. As the images show these different stages, they reveal a gradual deterioration of the vertebra, the discs, and the surrounding structures. As the spine undergoes these alterations, nerve pressure becomes increasingly prevalent. The once smooth pathways for nerve signals become constricted and impinged, leading to radicular symptoms that may manifest as pain, tingling, and weakness radiating into the shoulder, arm, possibly even the fingers. Many patients get this diagnosed by their medical doctors, but what do they recommend? Anti-inflammatories, nerve medicine, painkillers. And when these fail to give relief, they send them to the pain specialist for injections of cortisone or nerve blocks, ablation therapy. How will this ever work to correct the cause of the pinched nerve, the cervical radiculopathy? How many injections will it take to fix this? And while physiotherapy, massage therapy, and acupuncture each have their own benefits in managing cervical radiculopathy, they may fall short in cases where the underlying cause is not effectively addressed. While these modalities can provide temporary relief by alleviating symptoms and improving muscle function, they often do not directly target the root causes, the alignment and degenerative changes of the spine. Thus, while they can complement comprehensive care, they may not fully resolve the underlying issues driving the condition. So what's needed? If the spine is like this, pinching this nerve, compressing this nerve that goes down the arm, causing neck pain and arm pain, tingling, numbness in the hands and the fingers, what should you do? Logic tells us we need to fix it. And that is exactly what specific chiropractic adjustments are designed to do. Now, adjustments can be performed many ways. Our intent here is always precision and as little force as necessary, whether with a terminal point drop table or just by hand or with additional instruments. The intent is to gently shift the vertebra from its stuck position, and each time we adjust, we want to retrain the spine's alignment to, more importantly, reduce the nerve pressure. Many times we need to address posture as well to ensure that the lower portion of the neck has optimal vertical positioning. Forward head carriage, drop shoulders, these both add pressure, strain, and weight overload to the supportive structures of the neck, your spine. When we detect and correct the cause, we truly create an optimal environment for healing. Your body is a remarkable machine with an innate ability to heal when given the right support. That's where chiropractic care seems almost miraculous and magical, as some people may state, by providing your body and nerves with the support they need to thrive. Now, it's important to note that while the neck and arm symptoms may be relatively new, there could have been a long-standing issue with the neck and even the upper thoracic spine. Alternatively, it's worth mentioning that cervical radiculopathy can present only as nerve pain in the arms, numbness or tingling even, but it does not always have any associated neck pain. The good news is that corrective chiropractic care, through the delivery of specific chiropractic adjustments, has helped hundreds if not thousands of people recover from cervical radiculopathy. This brings us to today's recovery spotlight. Nicole presented as a referral in 2022 with locking and numbness in one of her right fingers. And as someone already wanting natural health and pain relief methods, she'd been for surgical consults with little to no interest in letting a knife doctor touch her. It was a constant nuisance for her, not being able to feel her fingertip properly, sometimes having grip strength issues, holding things, annoying to say the least. So we applied our standard procedures. We went through a thorough consultation, an exam including posture assessment, computerized nerve scans, and standing postural x-rays, as well as spinal analysis, to thoroughly assess the root causes. We found subluxation, alignment issues with some degenerative changes at C5 and C6, as well as some issues in the upper thoracic alignment. We started adjustments right away. She was excited. 3 times a week for a few months, and then reducing to 2 times per week for 3 months. This was the initial intensive phase and some of the stabilizing phase of care. Changes in her finger were gradual until about the 3rd month, if I recall, where she consistently noticed more movement, sensation, and comfort. It has now been about 1.5 years of care, and with some longer breaks for travel within her care that she required, we've noticed improvements in her mobility, her posture, her comfort, energy levels. She's certainly one of my more lively, shouting from the rooftops patients about her avoidance of the knife doctor. But it's not a small detail, right? No matter where you are right now or how chronic your neck or arm pain has been, I want you to know that there's hope. Even when other forms of therapy may have failed you, if you've not had specific chiropractic spinal evaluations and corrections, it's something you can link into. Always remember, the body has a remarkable ability to heal when supported well. Sometimes the support that's missing is that correction of spinal misalignments, of subluxations. Listen, I covered a lot in this video, but I want you to leave with a simple exercise you can do at home that may start to give you relief of arm pain, something in the fingers, the shoulder. It's called a nerve floss or a nerve glide. Now, you can do the same thing on both sides, but you're just going to tip your head to one side. Let's say you're having left arm pain or sensation issues. And you basically want to put your arm up in a bicycle stop sign position or hand up. And the goal is to extend and open your arm and tip your head away like this. Now, you should feel some sensation happening in your arm, in the shoulder area, perhaps down to the elbow. That's okay. You can hold these for 5 seconds at a time, less if it's intense, so it can be up. And just like flossing, stretching the nerve gently, letting it glide through the channels it exists in, just gives the nerve some better movement and mobility. And again, do both sides, but start with a more effective side. Let me know how it goes. Now I want to hear from you. Share your experience with neck pain or arm pain. What did you do for it? What worked for you? What didn't work for you? What frustrations or worries do you have about it? Leave a comment, share your thoughts. If you found value in this video, do like and share the video. Help get it to others who are suffering with cervical radiculopathy. Remember to subscribe if you want to enjoy a more comfortable and active life with better posture, increased mobility, and free of chronic pain. Now, the next video I suggest you watch, this one. Some people with cervical radiculopathy may have other associated symptoms caused by subluxations of the neck, such as dizziness. Go watch this video right here, where I show 2 specific and safe chiropractic adjustments for dizziness.